All right, so the first part of the physical exam for the neuro part 2, doing the same thing that you always do. Introduce yourself, verify the patient name and date of birth, get 5 neurologic review of systems so that you can practice that stuff. Then the next thing that you're going to do is dermatomes, which you're going to use the light touch. So as long as your patient's dermatomes are intact, you can just stay with the light touch. If not, that's when you would go to the other things like vibration, temperature, sharp and dull, okay? So should only be the cotton wisp sort of light touch for this. So you want to tell the patient what kind of sensation they're going to feel. So let them watch it with their eyes open. This is what you're going to feel. Do you feel that? Okay. Then when I have you close your eyes, all you're going to tell me is that you feel it or when you feel it, okay? So I'm going to be touching various parts of your body. You tell me when you feel it, okay? So you can go ahead and close your eyes. So we're just going to go down the dermatomes. C3 is the anterior and posterior neck. C5, anterior lateral upper arm. C6, lateral wrist and thumb. Good. C7 is middle and index finger. And then C8, ring and little. T4 is, you stated, it's at the nipple line. T10 is at the umbilicus. L1, inguinal area, again, you just state that one. L2, anterior upper leg. L3, medial upper leg. And it actually kind of goes to the knee, so you can go there. L4, medial calf, anterior knee. L5, lateral calf. And big toe. S1 is the lateral foot, and then under on the sole of the foot. And then you state that S5 is the perianal area if you don't do that one, okay? All right, you can open your eyes. Then proprioception, we want you to do on both upper and lower extremities, and you can just do it once. You don't need to do it on every single finger and every single toe. So can you take your shoes off and your socks? Just one? Yeah, just one. Okay, so that's, you can just stay seated there. So essentially the proprioception is where is the digit in space. So you're gonna tell them what's normal. So let me see your fingers. This is gonna be up and this is down. You tell me what you feel. So shut your eyes and tell me if it's up or down.
Down, up.
Good. And you hold whether it's the toe or the finger by the sides. If you do it top and bottom, the patient can actually figure out based on the pressure which finger is closest and up and down, so it helps them cheat. Now I'm going to do the same thing on your toes. You can open your eyes. This is up and this is down. You tell me what you feel. Okay, close your eyes.
Up. Oh, and that's down.
Good.
Up.
Good. So do both upper and lower, right and left, but you don't need to do every toe and every finger. Temperature. And we also want you to state what it's testing. So the proprioception is the posterior columns. The temperature is the spinal thalamic tract. So this is going to be cold and this is going to be warm. Can you tell the difference between the two? Okay, close your eyes and tell me if you feel warm or cold.
Cold. Warm. Cold. Cold.
Good. So again, upper and lower, right and left. Vibration sense, the posterior columns, you want to do both upper and lower extremities. You're starting with the most distal joint to check, and if they can't feel it, you move proximal until they feel it. Okay, so let me tell you what normal is. This is what you should feel. You feel that vibration? Okay. You tell me when you feel it and then when it stops. So go ahead and close your eyes.
I feel it. And stop.
Good.
I feel it. Stop.
Good. Okay, you you can open your eyes. Now I'm gonna put 2 different objects in your hand, and you can tell me what it is. So close your eyes, feel what that is, and tell me what that is.
A pencil.
Good. And then what is this?
A paperclip.
Good. So 2 different objects, one in the right hand, one in the left hand. And that's stereognosis. Graphesthesia is drawing or writing in the palm of the hand, generally a number, and you ask the patient to identify it. So I'm gonna draw a number in your hand, close your eyes, and tell me what you feel.
1, 0.
Good. Then 2-point or point localization, I'm gonna touch somewhere on her body with her eyes closed. She's gonna tell me where I pointed. So I'm gonna touch you somewhere, you point to where I pointed, okay? Good. The next thing is I'm gonna touch on the right side, the left side, or both sides. You tell me if it's right, left, or both, okay?
Right. Left. Both.
Good. Then 2-point discrimination this is where you use the paper clip. You're gonna be 2 points and trying to get it until she can only feel 1. You do it on the finger pad. That's where the 5 millimeter sort of rule is. So I'm gonna have you tell me whether you feel 1 point or 2 points, okay? So can you feel that that's 1?
Mm-hmm.
And can you feel that that's 2?
Mm-hmm.
Good. Okay, so close your eyes and tell me whether you feel 2 or 1.
2, 2, 2, 1.
Good. So I don't know if you can see it. She got it was about that far, which is normal, that it became 1 point. So all I did was kind of pinched it in and continued to get it in. Okay, so then the next thing is deep tendon reflexes. So these, again, do them bilaterally. I'll show you if you need the patient, if you're having trouble getting the patient to relax. If you're working in the upper extremity, have them do something with their lower extremities. If you're doing the lower extremities, have them do something with the upper extremity. We also want you to say what nerve root this is and which sort of reflex you're getting. So the first one I usually do is brachioradialis. You can feel for the tendon, especially if you're having trouble. You should be able to kind of, if you're close enough, you can see me sort of rolling over that tendon. So then once you're in the right place, you can actually hit it. You can use your finger underneath, or you can directly hit onto the tendon. Those of you who are close should be able to see that this actually sort of reflexes and moves a little bit. The biceps here. So this is C6 and C7. This one's C5 and C6. Again, I'm feeling for the biceps tendon. Have my finger on it, and then I'm hitting it. So if you're close, I can feel the tendon when I actually slap, but then you can also see it across here. The patient can help you with these. They generally can feel if you're in the right place. The triceps, make sure that the patient is relaxed. And again, you're gonna feel if you can. This one's the most difficult for a lot of people, especially if you're working on somebody that has bigger arms. It's just hard to sort of get it. So you can see it, her arms moving. Okay, good. Then patellar, just gonna be just below the patella. See it? And then the Achilles, I usually lift up on the foot, and you're gonna just hit that Achilles tendon. She's got good reflexes that you can see from far away. Good. So that's biceps, triceps, brachioradialis up here, quadriceps or patella, and Achilles. Let's see, I'll have you lay down and I'll do a couple of the other ones. Go ahead, lay back. The abdominal ones, you just use soft touch. You're gonna do right and left above the umbilicus, and you should just kind of see the skin reflex. And then below the umbilicus on the right and the left. Sorry.
Good.
Let's see. Anal reflex, you're just stating that it's S2, 3, and 4. You're not actually doing that. Then the only other thing on there as a reflex is the plantar or the Babinski. So you come to the bottom, you're gonna do it underneath. What are we looking for? Down going toes. You have to push pretty hard, and for somebody, it's not comfortable. Ready? So our toes are kind of, yeah, do it again. Sorry. So push hard, start at the heel, all the way up under the toes. See, I think that's, I'm gonna have you sit for ankle clonus. Okay, so ankle clonus, you're gonna plantar flex and dorsiflex the foot, and then you forcefully dorsiflex, and then you relax, okay? So move it up and down a couple of times, and then you plantar flex, and you're just waiting. As long as the foot stays relaxed, it's a negative response. Positive, it's gonna have that sort of oscillation after that plantar flexion, or the dorsiflexion, sorry. Okay, that's deep tendon reflexes. Then we do strength. Most of these you've already done before, and so it's really just putting what is the nerve and the nerve root with the muscle strength. So the things we want you to know is be able to tell the grader what muscle strength your patient is, and then what is sort of the ranges of normal and abnormal. So know the, on a 0 to 5 scale, what are those muscle strengths? So here's the one that you actually have to do. So shoulder abduction, resist me going out like that. Then you say that that's the axillary nerve, C5, C6. So that's how you're gonna do it. Then you do elbow flexion, so like this, resist. And then you do extension, good. And then bend your wrists up, and then push away. Oh, sorry.
You're good.
Good, and then grip strength, good. So the ones that you can do bilaterally, do them at the same time. Again, keep listing the nerve and the nerve root as you go along, so you may need to be slower than I did it to get all that stuff in. That's all the upper, no. Then you have finger abduction. So you're gonna sort of separate your fingers, and then I'm gonna try and push them together. You keep them separated, good. And then thumb opposition, get your thumb to your pinky. Keep, good. And on this side, good. So you're resisting that sort of push in, and then the resisting across to the pinky. Okay, we'll do it sort of in order so I don't forget anything. Hip, we generally do laying down. So you're gonna lift your thigh toward the ceiling. So hip flexion, then push down, extension, good. Push out toward the outside and push in, good. So again, strength over one joint, all of those. Then we go to knee. So sit up, push your legs out toward me, pull them back toward you. Do both dorsiflexion and plantar flexion. So pull your feet to your nose, good, and down like you're on a gas pedal, good. Then we do coordination for cerebellar function. So the first thing is rapid alternating movements. So do what I do, okay? So with your right hand, go like this, and then do it as fast as you can, good. And then with the left hand, and as fast as you can, and then both together, good. And then the feet, it's gonna be like down on a gas pedal, okay? So up and down as fast as you can, and then with this one, and then both, good. Let's see. Then the point-to-point movements, I'm gonna have you touch your nose and then touch my finger. With your eyes open, and my finger's gonna move. So go ahead, touch your nose, touch my finger, and then your nose, my finger, nose, my finger. We're gonna go back to the beginning. Then you touch your nose, finger. Then I want you to touch my finger, close your eyes, go straight up into the sky, and back down to my finger. Good. Okay? So a couple of times moving it around, come back, let them find your finger, up from your finger toward the sky and back down with their eyes closed. Then the point to point in the lower extremity is called the heel to shin. So take your right heel and put it on your shin, go all the way down and then sort of off the end of your toe. Yep. And then you do that on the same side, the other side. Good. Okay, then I'm gonna have you slip your other shoe off just so you're not off balance. The rest of it is standing. So hop down. And you wanna be sort of with the patient so that you don't, it's like,
Oh, it's my shoe.
okay, so that you can support the patient if they go to fall. So the first one is I'm doing Romberg and someone help me. Pronator drift, Romberg. So feet together, close your eyes, and you're just gonna stand here. So I'm gonna watch her for 30 to 60 seconds. Make sure that she stays upright, she doesn't lose her balance. Okay, so 30 to 60 seconds later, you can open your eyes. And you can bring your feet out just apart a little bit. I want you to put your hands out like this and see if you can keep them steady. Again, staying here to make sure the patient doesn't move. Then if things are steady, push on down on the arm and make sure it comes back up. Good. So a positive test is gonna be this comes down and she pronates. Okay, good. Open your eyes. Now you watch their gait. So turn that way and walk just sort of regular down. And then turn, come back, except walk heel to toe, so right in front of the other. Good. Now walk on your toes. And then walk on your heels. Good. Then you can hop on one foot. You can use this if you need to. Don't lose your balance. Good. And then switch to the other foot. Good. And then a shallow knee bend. So hang on to the table and bend down. Switch and go down with the other foot. Good. Okay, then special tests. So some of these are testing for meningitis and some of them are testing for lower back stuff, so like sciatic. I'm gonna have you lay up on the table. Okay, nuchal rigidity is first. So go ahead and see if you can get your chin to your chest. Good. So she can do that, she's not stiff, so her nuchal rigidity is negative. The next one is similar, only I'm gonna sort of lift her head. So I'm gonna put your head like this, and what I'm looking for is hips and knees, that they stay relaxed, you can relax. If it's a positive test, it sort of flexes and comes up, okay? The Koenig sign, I flex, relax at the hip and the knee, and then I straighten the leg. And I'm making sure that the patient doesn't have sort of lower back pain or pain that goes down the leg. A little bit of uncomfortable just because you're stretching is all right, but pain is a positive test. Straight leg test, so similar to the one you just did, only straight and then up until they can't go anymore. And then the last one I'll have you sit is checking for asterixis. And that you, with both of your hands, stop traffic. And you wait and you watch for a minute or two. So she's gonna have a negative test and the positive test is this. So movement similar to Clonus. Good. All right, that's the whole checklist.